adults are more likely to die from heart disease than any other community, a reality that has worsened during the pandemic, which is why the CDC Foundation is launching the first national cardiovascular disease prevention campaign created specifically for the Black community. February is both American Heart Month and Black History Month, which makes the Live to the Beat campaign launch timely for the community. Joining us today to learn more about this campaign is Dr. Lisa Waddell, Chief Medical Officer for the CDC Foundation, and Tara Robinson, a three-time heart attack survivor and founder and CEO of the Black Heart Association. Thank you so much for joining me today.
Thank you for having us.
Now, first, Dr. Waddell, tell us, how does the problem of cardiovascular disease especially impact the Black community?
McCabe, we have a significant problem with cardiovascular disease in the United States. 1 in 3 deaths in the United States are due to cardiovascular disease, and Black Americans are 2 times more likely to die from cardiovascular disease in comparison to our white counterparts. And nearly half of all Black men and women in the United States are living with some form of cardiovascular disease. We also are concerned that the rates of cardiovascular disease deaths are rising among younger people between the ages of 25 and 65. And we also know that Black Americans have some of the highest high blood pressure or hypertension rates in the world. And that's a significant risk factor for cardiovascular disease. So we have a significant problem, and that's why we're so pleased that the CDC Foundation has launched this new campaign called Live to the Beat to help Black Americans focus on this important issue.
Absolutely, and like you said, now is the time more than ever to address the increasing rate of heart health for Black Americans. Tell us more about the campaign.
So the campaign is called Live to the Beat, and it really is informed by information that we received from Black Americans who have risk factors for cardiovascular disease. And the campaign really focuses on living. It focuses on the small steps that one can take. It focuses on the positivity and focuses on believing and building the confidence that if you take these small steps, it can have a big impact on your heart health. The small steps include physical activity, small things. It may be moving to the beat while listening to some music, walking around while you're talking on your phone, doing some knee lifts, doing some counter push-ups, walking the stairs more. Focuses on small things that you can do with healthy eating. Have more fruits and vegetables by making a healthy smoothie to get those vegetables in. And of course, having a relationship with your healthcare professional, particularly to make sure you're getting your blood pressure checked.
Absolutely. Those are all some really great tips and some, like you said, some small yet effective things that we can do to lower our risk of heart disease. And as a lot of people know, I'm very passionate about reducing the risk and the rate of heart disease, especially among Black women, losing my mother to heart disease years ago. So I am very much a champion for the fight against heart disease and improving our heart health in our community. Now, Tara, you are a 3-time heart attack survivor. That's just very amazing. Tell us more about your personal journey and your experience with heart disease.
My experience with heart disease has been interesting. It started in 2013, and then 4 months later in April, over the course of 3 days, I was having heart attacks. 2 went undiagnosed, and the third one ended in a massive heart attack with 99% blockage in my left artery, known as the Widowmaker. I also experienced sudden death. And then after that, that led me to start the Black Heart Association so that I could help others take the small steps they need to live to the beat on their own journey to be healthy. Prevention over treatment is the goal, and we just want our people to live.
Yes, we do. Now, with your experience, tell us what are some things that our community can look out for that may give them an indication, hey, it's time to go to the doctor, it's time to go get checked out. You said that two of your heart attacks went undiagnosed. So tell us what signs and symptoms that we should be looking out for.
Uh, for women, it can be no signs at all, or it can be as simple as hip pain or headache or tension in your jaw, left arm numbness, your neck bothering you. You'll hear a lot of women complain about upper back pain. You'll feel pressure in your chest. You hear, men often clench. Women sometimes just feel a lot of pressure. For me, it was like a pill was stuck. You can feel hot and clammy or like you need to vomit, but you know your body. You're the specialist of your own body, and you know when something is off. So don't ignore fatigue. Don't ignore anything that's different for you. Take the initiative and get to the doctor.
Yes, thank you for sharing that. We have to improve ourselves and being our own health advocates. Now, doctor, tell us, what are some final thoughts that you would like to share, especially with not only our black community, but particularly with black women about heart health? And Tara, what are some final thoughts that you would like to share as well?
Tara's story is so powerful because it really speaks to that this can happen to anyone. And so that's why that on-the-ground work that she's doing is so important. And it's why it's such good news that we have this Live to the Beat campaign. You can find information at livetothebeat.org, lots of tips and tools there, because no matter where you are or who you are, there are these small steps that you can take. Begin in the place that makes sense for you and get started, because in the end, these small steps add up. They have a big impact, and focus on believing that those things will make a difference, because they will. We want to focus on living, and that's what this campaign is all about.
Excellent. That's wonderful advice there. And again, for more information on the campaign, as well as getting tips and advice on how to reduce your risk of heart disease and live more, visit livetothebeat.org for that information. Thank you so much, Doctor, and thank you, Tara. It's been a pleasure having you.
Thank you so much.
Thank you.